my audience. Hi, my name is Danielle and I have multiple chins. I have struggled with maintaining a positive body image for almost my entire life. I also struggle with consistently exercising. I go through spurts where I will work out every day for months. And then, for whatever reason, I fall off the horse and I won't touch a dumbbell for another few months. Throughout all of this up and down, I've experienced something that I completely unexpected. My overall mood and mental health significantly improve when I am exercising consistently. I know there are some people who seem to be happy all of the time, but I think most people experience ups and downs of emotions and struggle with negative thoughts regularly. I have learned that something as simple as regularly exercising can help with these mood swings, negative thoughts, and even reduce stress. Today, I would like to share some information that shows how physical exercise affects the body on a molecular level, how it affects the brain, and how it is used as a treatment for depression. First, I'll talk a little bit how exercise affects the body on a molecular level. In 2014, Hannah Stower reviewed a study that was done on mice that showed endurance training increased the PGC1 alpha protein and CAT enzymes in muscle. The mice who had this increase in PGC1 alpha and CAT enzymes showed a decrease in depression-like behavior. Stower also explained how, during this study, some mice were deliberately given kynurenine, which is the chemical that CAT enzymes convert into kynurenic acid. The kynurenine was inducing depressive-like behavior in these mice. This study was then compared to a 3-week-long training program for humans that also resulted in elevated PGC1 alpha and CAT enzyme levels, which suggests that the idea that exercise improves mood could also be applied to humans. This study really shows that regular exercise can have a significant effect on depression at the molecular level. Next, I want to talk about how exercise affects the brain. In the International Journal of Molecular Sciences, published in 2021, Soares says that brain functions are influenced by physical activity and that physical activity is now seen as an effective treatment for depression. According to Diakonova in Frontiers in Behavioral Neuroscience, published in 2022, physical exercise is one of the most powerful forms of behavioral modulation of cognitive function in mammals. This is because, as Amanda Daly explains in the Journal of Clinical Psychology in Medical Settings, exercise results in an increase in availability of neurotransmitters in the brain that are typically found to reduce depression. Now that we've covered exactly how exercise affects your molecules and brain, I would lastly like to talk about exercise as a form of treatment for depression. In Perspectives in Psychiatric Care in 2020, Yates concludes that increased physical activity as a treatment for depression resulted in improved self-management and depressive symptoms, and even helps prevent future depressive episodes. It is also found that physical exercise as a treatment is effective on its own or coupled with depression medications, depending on the severity of the depression. As you can see, physical exercise is not only beneficial to physical health, but also to mental health. It affects our bodies on a molecular level and in our brains, and is even used as potential treatment for depression. It is amazing to me that something that seems so simple can be so beneficial for everyone.